So me, Grant, who's walking up here, and then Jackie, who will be in here soon with us, are all a part of this program. But before we get started, we're going to have you do a QR code, maybe. If I can get this to work. I might need the help with the clicker.
Please excuse this announcement. Those students who are interested in attending the healthcare career presentation, please go to the little theater. Thank you.
All right, and then once you're done with the QR code, there should be just a couple of questions that everybody should know the answer to. And that just helps us get funding for the VR headsets that we use. And then you can put your phones back in your pockets.
Okay, like Taylor said, we're from the WARM program, the Wisconsin Academy for Rural Medicine. So this is a training program for students to become physicians or doctors. The goal of the program is really to bring students from smaller areas or rural towns back to kind of rural areas. So if you're wanting to become a doctor and come back to a smaller area or somewhere like Eau Claire in the future, this might be the program for you. We do training in Madison, more lecture-based, and then we also do clinical training in 3 different sites across Wisconsin, so Marshfield, Green Bay, and La Crosse.
And how many people here are interested in healthcare? Everybody, almost everybody. That's awesome. Okay, cool. Well, I'm Grant. I'm from New Richmond, Wisconsin originally. My path to medicine started my junior year in high school. I broke my hand playing basketball. You see the surgical scar there. And it was my family care doc that diagnosed me with an x-ray. Ended up getting surgery, loved the team aspect of medicine. And I realized then that I wanted to dedicate my career to helping others. And, you know, healthcare is a great way to find reward in doing that. So I ended up going to college at Marquette University, which is in Milwaukee. Got good education there, and then I took a gap year working as a nursing assistant in a big hospital in Milwaukee in the cancer unit there. So after that, I decided to go to medical school. I chose the WARM program because I wanted to give back to smaller communities that helped raise me, like New Richmond. And I'm going to be a neurologist, which is kind of a brain doctor, stroke, seizures, that kind of thing. That's what I'm interested in.
I'm Taylor. I'm originally from Cumberland, Wisconsin, so about an hour from here. When I was in high school, I really loved my anatomy classes, my biology classes, and that kind of made me think that maybe healthcare was the right field for me. And so I decided to get my CNA license and work at the local hospital there in Cumberland for a while, which gave me some really great exposure to like nursing, physical therapy, working with the doctors, and kind of figure out what I really liked. And then I went to college at UW La Crosse for biology, and I still liked my anatomy classes and my biology classes there, and ended up deciding to apply to become a doctor. So I applied to the WARM program because I felt like it was a really awesome opportunity to do some training closer to home. I love to be home with my family in Cumberland. So we get to do some of our rotations here in Eau Claire, also some in Rice Lake, so places closer to home than Madison is, and then also get some more hands-on training that's a little bit more specialized for people who potentially want to come back to a smaller area as well. And I'm going to be a pediatrician, so kid doctor.
My name is Jackie. I'm from Cashton, Wisconsin, which is south of here, a town of like 1,000 people. In high school, when I was sitting in your guys' chairs, I had no idea what I wanted to do, so I started with a mathematics major in La Crosse. I eventually shadowed a physician and really fell in love with the role of a doctor as the leader of the team. So I changed my major to biology. I really liked the anatomy and the science classes that I took at UW La Crosse. I also got a certificate as a nursing assistant and worked in the ER, and then I became a first responder as well as my hometown, so I got to see the emergency side of things and how your adrenaline pumps in those situations. I chose the WARM program because I grew up in such a small town that I kind of want to return to an area like that, and this really gives me the opportunity to train in those areas and prepare me to return to a smaller town. I'm going to be a surgeon, so someone that takes out like gallbladders and appendixes.
All right, I talked. So this is a patient presentation for you guys. It's based off a real person. So this is Alan. He's a 70-year-old guy, 4 children, 7 grandchildren. He's a big fan of the Packers, loves fishing. He kind of lives in the middle of nowhere. Nearest hospital is about 25 minutes away.
So as far as past medical history for Alan, he hasn't been to the doctor in over 15 years. He smokes cigarettes, 2 packs a day. And one time when he was at the doctor over 15 years ago, he was told that his blood pressure was high, but he wasn't started on any medications and didn't make any lifestyle changes.
Okay, so when somebody gets sick, they either go to the hospital or call 911, right? And whoever talks to them first, whether it's a nurse or a doctor, collects what's called the history of present illness. So that's what we have here. It's kind of the story of what's happening. So Alan's family calls 911. They say that he was hosting dinner for them, and he started to kind of not make sense. The right side of his face was kind of droopy. He was trying to hold his fork to eat dinner, but then his hand was kind of weak on the right side, and they got worried, so they called. Does anyone want to take a guess on what's happening? Saw you first. A stroke. Amazing. Yeah, so you guys were right. You spotted a stroke, and the way to do that is with the B-FAST criteria. So B is for balance. You might be kind of off kilter. E is for eyes, might have some blurry vision. F is for face, so he had that drooping of the right side of his face. A is for arms and legs, so he had some weakness in his right hand. S is for speech, they might not make sense or they might be slurring. And then T is for time, so you're supposed to call 911 and get them to the hospital as soon as possible, right?
And what part of the brain is he having the stroke, based off his symptoms?
His right side is...
Right-handed. How do we know it's left side? Right, yeah, the right side of your brain controls the left side of your body and vice versa. And then where's the language center in the brain? Usually. Left side too. So if you have broken speech, you're having difficult understanding things, we think that it's probably a left-sided stroke. Very good. All right, so Alan's family recognizes something's wrong. They call 911, but remember, Alan lives kind of in the middle of nowhere, right? It takes a while for the ambulance to get to him. So about 25, 30 minutes later or so, ambulance arrives, takes Alan away back to the hospital, but unfortunately it's too late. He passes away later that night in the hospital.
So like Grant had mentioned, unfortunately for people who live in smaller areas, they're more likely to pass away from these 5 leading causes of death than somebody who lives in an urban area. So more likely to die from heart disease, cancer, unintentional injuries, problems with your lungs, or a stroke like Alan. If you live in a smaller town like where we grew up, or even in Eau Claire where you might not have as quick of access as hospitals as you would if you lived in Madison or Milwaukee or the Twin Cities, which are really big city areas, right?
So why do we think that is? Why are people in small areas or small towns having worse health outcomes than people in big cities?
Because they feel more like
They feel more what?
they feel more like easier to get around places and stuff.
Yeah.
And like it's harder for people to get like for them to get places because there's so many it's shorter to get like it's longer to get somewhere than it is for somewhere that's like bigger because of how many people are in the small area, and so it's harder for them to get to where they need.
Sure, yeah, access is a big one, right? Like in Alan's case, it took, an extended period of time versus somebody who might live in Madison and only has like a 5-minute commute or something like that. That's a big reason. Any other ideas? No dumb answers. Okay, well, what would be an example, Taylor?
So we mentioned that you're more likely to die from unintentional injuries. Can you think of anything that you might do here or in a smaller community? Yeah. Was that a hand or no? Okay, that you might do in a smaller community than you do in like Madison? Yeah.
Yeah.
Farming, yeah, super high risk profession. There's lots of injuries that come along with farming. What about like in a tree stand in the fall? Anybody? We don't have any hunters here.
More hunting accidents, right? In small towns, that's another reason why. Or what about the fact that sometimes there are hospitals or clinics, but you don't always have all the specialists. Like if Alan needs to see a cardiologist or a heart doctor, he might have to go all the way to the Twin Cities for those checkups, right? So that's another thing to consider is even when the clinics are nearby, sometimes you don't have the proper resources you need to get treatment quickly, right? So this intimidating graph is just a look at different healthcare providers, not just doctors, and where they're distributed in their practice. Are they in big cities or are they in small towns? So the gray bar is big cities, the right side, or the red bars are small towns. So obviously the gray bar is always going to be bigger. We need more people, there are more people in big cities, so we need more providers in big cities. But the issue is when they're not proportional. So we want the red bar to at least reach that black line. If you see the black horizontal line, that would mean that there's enough, why am I struggling with this? That means that there'd be enough providers in small towns to avoid a shortage. So anytime the red bar is below the black line, there's a shortage of that profession. So we have a shortage of nurses over here, we have a shortage of physician assistants, a shortage of pharmacists, and a shortage of doctors in small towns. So even if you guys aren't interested in going to medical school and becoming doctors, if you're still interested in the healthcare field, we encourage you to stay in these smaller communities because there's a need across the board in healthcare for people to stay.
So that's why the WARM program was kind of established. So it's the Wisconsin Academy for Rural Medicine, like we said. It's a training to become a doctor. It's at the University of Wisconsin School of Medicine and Public Health. Like I said, you do some training in Madison, and then you also get to train across Wisconsin in smaller areas. They admit 26 students each year, and again, the training is in Marshfield, La Crosse, or Green Bay. And when you're done with the training, you can go into any specialty to become a doctor as you want. So there's no limits on specialty.
So Jackie kind of mentioned there that there is no limit on what type of specialty you go into. Do you guys know what a specialty in medicine is? I see nods. Do you want to take a shot at it? Anybody? Like list some specialties maybe? Yeah.
Veterinarian.
A veterinarian. So that would be if you're going to take care of pets, right? Different types of animals. Yeah. What about like within people medicine? Yeah. Yep. So she said you can specialize in a specific area of medicine. So Grant is going to be a neurologist, which is a brain doctor. We also mentioned cardiologist, which is a heart doctor. Any other types of doctors? Yeah.
An optometrist or
Yeah.
an
Yep. Orthopedics and optometrists. Those are eye doctors and bone doctors. Amazing. We didn't get optometrists at any other schools.
What's a skin doctor? Dermatologist. What's a doctor that looks at images? Radiologist. I hear radiologist. Nice. What about mental health doctor? Psychiatrist. Okay, cool. See, you guys are specialties. All right, so this is a breakdown of all the different specialties that people in our program go into. So it's a big diversity of different specialties. Number one far and away is family medicine. But that makes sense because their family medicine is the most common kind of specialty, and we need more family medicine docs than any other ones. Think about you guys, if you guys need like a routine checkup or a sports physical, something like that, a lot of you end up going to family med doctors. So primary care is very important. But we have people that go into other specialties as well. We have internal medicine. So if you guys get hospitalized, the doctor that takes care of you while you're in the hospital is an internal medicine doctor. If you guys slice off your finger, go to the ER, first doctor that's going to see you is an emergency medicine doctor. OBGYN, what does OBGYN do? Yeah. Excellent, yeah, women's health, delivering babies. So we talked about psychiatry, anesthesiology, putting people to sleep for surgeries, right? So the point is, in the WARM program, regardless of your interests, the WARM program provides you with the needs you need, or the resources you need to get into whatever specialty you choose. You're not just limited to one or two specialties. So that's a big perk of our program.
There's a lot of other perks of our program in our opinion too. We really like that you get to have really close mentors. So when you're going to a smaller area where maybe you're the only student at a site, you really get really close relationships with different physicians. You also get really good hands-on experience and one-on-one exposure to different things because maybe you're the only student there and 5 different doctors know that you're there and they can come pull you into any situation that they think is really educational. Our program is pretty small too, so we get a really close-knit group of people together. All of these pictures here kind of show that we're all friends and really get to know each other. We also get really good hands-on training in rural specialty care. So we do like a wilderness training, and we get training in places that maybe Madison students wouldn't get because we're in rural areas where different things occur.
All right, so the roadmap to medical school. Where do we start? You guys are working on number 1, right? Graduate high school. Number 2 is to get an undergrad degree or to go to college, 4-year program. So a big misconception with college is that you need, in order to do a healthcare profession, you need to, or I should say, to go to medical school, you need to do a science-related major. That's not true. You do need to get like your prereqs done, like biology, physics, and certain general science classes, but you can really major in whatever you want. A big example that we use, is somebody in our class was a dance major. That's something that they were really interested in. They're still able to go to medical school because they got their basic science credits completed. One thing that you absolutely need to do is need to take the MCAT. The MCAT is basically a souped up ACT. It is the standardized exam for medical school. So you need to take that. The last 4 aren't necessarily required, but if the first 2 are like pseudo-required. First thing is clinical experience. So if you guys are interested in the healthcare field, or really whatever field you're interested in, it is important to get exposure to that field. Getting CNA certified or EMT certified, be a first responder. Anything where you're interacting with patients is very, very important for any kind of resume, for any kind of secondary education in medical school, or in the medical field rather. So, and it's also a great way to kind of see, is healthcare a good fit for you? So you guys are blessed with, you guys got 2 hospitals now in Eau Claire, right? You have Marshfield Clinic and you have Mayo. That's a great way to start to get clinical exposure, volunteering and whatnot. Second thing is shadowing. And again, not necessarily just in healthcare, but whatever you guys are thinking about doing, it's great if you know somebody in the field and be able to shadow them. What is their day-to-day life? Is the workflow something you can see yourself doing for the rest of your life? That's really important. The last 2 aren't as important as the first 2 that I had mentioned, but still important nonetheless. Volunteering. Now, volunteering doesn't need to be necessarily clinical. I mean, if you guys have like a food pantry, homeless shelter, Habitat for Humanity, that's great ways to get out and to service others. That's what healthcare is all about. And it's really good at character building and just interacting with others, people in need. So that's important to do. And hopefully you guys have plenty of resources to engage in that at Eau Claire. You guys are a pretty decent sized city. So. And the last thing is research. Probably the least important of the 4 things that I've mentioned, but if you guys have a clinical question and you go to an institution that has really good research funding, to be able to ask a clinical question and to run an experiment, like the scientific method, to answer that question is really important. That's what healthcare is, right? We're problem solvers. So any way that you can engage in that kind of thought process is a good experience for you.
Alright, so some major takeaways for today before we move on to the next part of the presentation. One is that there's just a really strong need for doctors, like we're training to be, and then also all other health professions in smaller communities. So whether you want to be a doctor like us, or you want to be a nurse, a physical therapist, a pharmacist, somebody who works in the lab, somebody who's part of the custodial staff in a hospital, all of those things are really needed for you people to come back and want to work in smaller towns. If you're interested at all in our program, we're happy to always talk about it. You'll have our contact information. We're also happy to connect you with other resources if you're not necessarily interested in becoming a doctor, but you're thinking about something else and have some questions. We can try to connect you with somebody else that knows more about that type of stuff too. So that's our contact information. It's on the PowerPoint. You will have access to it if you need it. And then we'll have time for any questions and also another QR code. Questions?
Well, like one question to make us feel good.
Something that some other schools have brought up is kind of like, if you go into this program, are you required to like come back to a specific hospital or a smaller place? And that's not the case. We all are thinking that we might want to work in some smaller areas right now, but you could finish training and you could decide that you want to live in the Twin Cities, or you want to move to Florida and live in Miami, and that's totally fair, and nothing stops you from doing that at the end. Yeah. It is 26 students per year, but I would say that it's similar in competitiveness to any other medical school program. So it's not like you're going to be fighting harder for this than to just get into like the general Madison program or something like that.
There is a preference for in-state students. So when you look at like the overall competitiveness of medical school, it can be daunting. But if you like play the odds and say like, this is how many applicants come from Wisconsin and this is how many spots, like your chances of getting accepted are actually a little bit higher than what you think when you like research it online.
Yeah.
So
There's
that's
almost
something-
nobody in our program that is from out of state, so.
Is this program in place of medical school or the undergraduate program?
It's in place of medical school, yeah.
So, like, if you are in special ed, are you still able to get your 4 degree in college if you can't do only if you can do like adaptive stuff?
As long as you're capable of getting the prerequisites and finishing everything that you need for an application, you should be able to apply to medical school. So there's lots of supports available in college for you to be able to get through the classes that you have to get through. And as long as you do the prerequisites, you should be able to apply, yeah.
Any other questions?
Okay, so one more QR code, and then we have your attendance QR code on here as well. And this is just to see if there's any changes in perspective since we presented. And then make sure when you finish that last one, you grab this attendance one as well. And Jackie's got some print-offs of resource sheets. Does anybody want a resource sheet? Oh, sorry. Great, do you want to hand out resource sheets?
Sure. And like we said, we kind of just went through your county, so Eau Claire County, and we looked at all the hospitals, grabbed information from what do you call it? Like volunteer coordinators, phone numbers, emails of people if you guys are interested in more clinical experiences. Sorry, I'll just hand you guys the right back.
If there's anyone that came in a little late and didn't get to fill out the first survey, I have some paper copies if you would put one down for me.
Thank you.
Anyone else?
Okay, does everybody have their attendance QR code done? Do you want a resource sheet? Yeah.
Snapping these up.
So wondering how you decide what specialty. So usually people come into medical school either pretty undecided or they might change throughout medical school. So we're required to do rotations in all sorts of different things as we go through. And that kind of gives you exposure and makes you decide what you want to do. So Jackie came in thinking she wanted to be an emergency medicine doctor, and then got exposure to surgery and really loved it and fell in love with that. And now she's applying to be a surgeon. So it can change. You don't necessarily have to know before you come in what you want to do specifically.
Yeah, you get plenty of exposure during medical school and the required classes that you have to take to almost every specialty, so you kind of find what fits for you during that time.
How difficult is the MCAT, and how long did you study before you decided to take the MCAT?
Great question.
Great question.
It's hard. There's lots of resources.
I mean, it depends on how actively you're studying. If you are really grinding and only studying for the MCAT, you could probably study in 6 to 8 weeks maybe. Most people take a few months to study for it, I'd say. And then you take practice exams and stuff like that to kind of see where if you're in the ballpark of where you want to score. And the exam itself, I think, is 8 hours.
Yeah.
But there is a testing site here in Eau Claire, so that'd be one thing for you guys. Where I had to get a hotel to come here. So.
Also, it's all information that you're supposed to know from your prerequisites to get into medical school. So you should be learning that stuff throughout college, and then when you take the exam, a lot of it you should know, and then you'll be refreshing it as you study and gaining some more knowledge as well.
You typically take the MCAT the year before you plan on applying, because it can take, I can't remember how long it takes to come back. It takes a couple months for the score to come back. So you want to make sure like, oh, the score is competitive, and if you don't get a score you want, you can always retake it. You know, but ideally you only have to take that piece one time. So. That's a great question. Yeah, I think, I mean, for me personally, I knew what my goal was right away. I knew I wanted to be a doctor, and I had that little carrot dangling in front of me the entire time. I knew what I wanted in terms of what my life was going to look like, and I think if you have, and I did all the things that I mentioned. I had clinical experience in shadowing, and that's part of the reason you do those things, to make sure that when you commit yourself to another 4 years, you're doing it for the right reasons, because there's going to be a lot of times along the path where you're going to start questioning your intentions, and if you don't have a strong foundation in what you want to do, it's going to affect your motivation to keep going. So that's why if you guys shadow and you do these things and you're like, I love medicine, I can't see myself doing anything else, that helps you do the extra 4 years.
Yeah.
So lacrosse is like the program. Do you think you would technically be explained to me as a lacrosse?
I actually don't think so, that it was like more advantageous to go to lacrosse than any other undergrad program. I think as long as you show that you're like interested in serving rural communities or serving underserved communities, and you're obviously from Wisconsin, then you have a good chance of getting into the program if you're a good applicant.
All three of us actually did our rotations in Marshfield. So we went to undergrad in UW lacrosse, but we didn't actually do our rotations in lacrosse. So I don't think that's a prerequisite at all.
Yeah.
And I went to school at a big city, but I was from a small town. So it's all about narratives. Like when you guys apply to even for college, you might have like these essay portions. So what are the essays about? They're about gauging your character. They're about gauging your story. What makes you stand out? Not in a way like, oh, I did X, Y, Z. They want to know about you as a person. What's your story in life? How did you get to where you want to be? That's what it's all about. So for the WARM program, they're looking for kids that have kids. They're looking for adults that have a passion for servicing small towns. So if you guys grew up in, I mean, and you guys might not consider Eau Claire a small town, but in grand scheme of things it is. What do you have to support that you have a strong feeling towards people in this area? You know, are you volunteering? Are you doing X, Y, Z? Like that kind of thing. So that's more what it's about, more than where you went to undergrad, I'd say.
Yeah. Usually you apply pretty broadly. I know a couple of people who applied like just in Wisconsin because they knew they did not want to leave Wisconsin. But usually people apply all over the United States in different places that they might be interested in moving to.
Isolated. It's a great question.
Yeah.
Go ahead.
We do the first year and a half of our training all in Madison, so it's book work back there, lectures, and then after that is when we leave to go to the smaller communities, and you still have the opportunity to do electives back in Madison. So if you're like, oh, I've been doing these rotations in Marshfield, and Marshfield doesn't have like a specialist in this specific thing that I'm really interested in, then you go back to Madison and experience that as well. And we go back there for all of our exams and all that stuff too.
Yeah, I feel pretty well connected. My wife lives in Madison right now, so and I'd say like, so the first year and a half of medical school is like book work, and then you start going into the clinics and the hospitals and learning like hands-on. So that first year of that, for us, is required to be in Marshfield, like our core rotations. But like your last year and a half of medical school is a lot like figuring out what you want to do with your career, what kind of specialty, what kind of things you need to make sure that you can apply and get into whatever residency or specialty you want. So for me and Jackie and Taylor, a lot of us required rotations back in Madison to get letters of recommendation from people at the UW hospital. And we've spent extensive time our last year back in Madison, and we still feel pretty well connected with the people there. And again, my wife lives there, so I'd say most of my last year I've spent in Madison. So that's the kind of the nice thing about the program too, is like you have the flexibility still to maintain those connections. But that's a really good question.
We also brought some VR headsets. We might have time for like 6 people to hop on one quick and do like a simulation of a health career. There's knee surgery, there's placing IVs, there's showing up at a car crash as an emergency provider. Does that sound really interesting to anybody?